I want to explore a bit about the role and the work of the consultant pharmacist. So could you start by telling us what your job involves?
Absolutely. So I have a really varied role. So it's sometimes difficult to explain what I do on a day-to-day because it's quite variant. But I suppose, as with all consultant pharmacist posts, I practice across the pillars of RPS practice for a consultant pharmacist. So I have some clinical time, which I do across our healthcare system so that I understand all elements of that. So I do some type 1 diabetes in the trust, so in secondary care, and I do some more complex type 2 management within both our community services, but also in GP practices and primary care networks. And then the rest of my time is spent doing senior leadership within the ICB, and also within Leeds Place itself. I chair our cardiorenal metabolic expert working group, which leads into our long-term condition board, and I also chair the diabetes steering group, which also leads into our long-term condition board. So I have good oversight, not just in diabetes, but in also the connected disease states that need to be managed well in somebody living with diabetes. And I have an amazing team of consultant medics and nurses and variant other professions, and also managers and payers, and the right people around the table, which makes a huge difference to our health economy and what we spend our money wisely on.
Clearly, there's a lot involved. I know that consultant pharmacists in diabetes are a bit of a rarity, that there are just 3 in England at present. How do patients react to seeing you in clinic, and what do you say to them?
Yeah, I'm really transparent about the fact that I'm a pharmacist. I think it's very important. There's been obviously some chat around sort of consultant medics, the fact that we're called consultant in our title, which has been slightly challenging, I suppose, to deal with. Especially when you've worked really hard to get to that point. To be absolutely honest, Christine, I don't really care whether I'm called consultant or not. That somebody else has made that decision for me as to what the name of the post is. But I think the main thing is that it's a recognition of kind of the years put in, the expertise across all the pillars. And I think that's the difficulty with the consultant pharmacist post in many ways, is practicing across all of those pillars and making sure you're at a high level within each. So what you'll often find is that people may be very good clinically but not have the leadership parts of things, or likewise have lots of leadership, are very expert in that and have lots of management experience but not have the clinical expertise. So the real I suppose skill to a consultant portfolio is building up all your pillars at the same time, so they all arrive in a portfolio together, which is challenging and definitely has challenged me over the years getting to that point. So and I try and explain that to people. There are people who just are like, whatever, I'm just glad I'm seeing somebody. There are people who want to know more about my post and why they're seeing me and not a consultant medic, especially because some people have waited a long time to see a consultant doctor, and then they see me instead. And there is some people react fine to that and others not so. They want to know more, but I've never had anybody get up and walk out of my room, so that's a good thing. And normally we just say that we'll have the consultation. If you want to see a consultant doctor after me, I can push you through onto one of their lists, or we can see each other, get some stuff sorted, and then I can push you through, or likewise you can stay on my list depending on where we're at and how you're feeling. So I just leave it really open and really with them, as to how they're feeling. I think that's the best thing. I say that, I've gone through extensive training to be in this position. The trust hasn't signed me off to see consultant medic lists without doing their due diligence. So just to give them some comfort that they're seeing somebody who knows what they're talking about. But yeah, I don't labour it, but I make sure that they know that I'm a pharmacist. Most certainly, I think it's really important.
So why are there not more consultant pharmacists in diabetes?
Yeah, it's definitely developing. So we're seeing a lot more pharmacists taking an interest. And I think actually the primary care network roles have really starting to develop. People with an interest in diabetes. In Leeds, for example, we've just put out our first specialist diabetes post within a primary care network, which is really exciting. So I'm hoping there'll be a lot more of that, where people see the benefit that a pharmacist can bring to diabetes care. working alongside established roles within diabetes, such as the nursing roles, etc. So, and there's other roles obviously that dovetail into that, like the health and wellbeing coaches. So these are roles that have happened across the country now, are really accelerating, I suppose, the pharmacist role within multi-morbidity management with diabetes as part of that. So, so that's really exciting news. Why they're not more consultant pharmacists? I mean, it's definitely not for the faint-hearted, Christine. I think that a lot of people think that they want to do consultant pharmacists, and then, to be honest, I'm not. I still have to pinch myself every now and again that I've got here myself, because it is like I say, that balance of bringing all the pillars up at the same time is time consuming. It's not greatly compatible with other life around the sides of that. So I've got a little boy, Charlie, who definitely at times, you do wonder whether you've got your work-life balance correct, and all of that is difficult to balance amongst the really hefty workload, and also the national work that we do as part of our portfolio. So I think what I would like to see is the development of more highly specialist posts. So that step 2 consultant that would just give people, and some people may stay at that level, and some people may progress then on to consultant. And I think that's maybe why we don't get there with a lot of people, is they don't have that post to move into where they can develop themselves, where they can get some more exposure to some of the different elements of a portfolio. And I think if we develop those highly specialist posts, maybe 8B to 8C roles, and that would I think that would accelerate us getting to more consultant pharmacists in key disease areas which are high cost, high impact. We've got loads of people in our long-term condition population with diabetes. It's the highest, and we're now the highest spend because of the tech spend that's coming. So it's a ripe time to invest in a pathway for clinical leadership for pharmacists. So I would love to see that, and I hope that I'll manage to achieve that within Leeds. I'm already in process. There are some really exceptional people around me. Claire Rands is one of my colleagues who does an incredible job within our healthcare system and knows lots about diabetes. And for people like Claire, it would be incredible to see these posts come to be able to be offered.
Hannah Beba, consultant pharmacist in diabetes. Thank you very much for sharing your insights and experiences on these important topics. That really has been terrifically interesting. For more information about Hannah Beba's work, please visit our website using the links in the description, and be sure to subscribe for more news, videos and journals. For updates straight to your inbox, please follow the links below. And thanks for watching.